I'm Paula Peters. I'm on the national steering group of Disabled People Against Cuts, the grassroots campaigning group for disabled people, run by disabled people, and we campaign on using the social model of disability. So it's society that disables us with the barriers and its exclusion and marginalisation of us. We have a Labour government, and since Labour have got in, we've seen the means testing of winter fuel allowance for older people, and that includes older disabled people that have been impacted by the means testing of winter fuel allowance and by the equality impact assessment that the Department of Work and Pensions did. Over 76% of older people impacted by the means testing of winter fuel allowance have a disability. So there are two groups that have been impacted by that cut: disabled people and women over the age of 80. And I know quite a few people, as I'm sure you do, that have been impacted by this horrific proposal. And it's got to be said that if people look back to 2013, 2014, when Rachel Reeves was the then Shadow Secretary of State for the Department of Work and Pensions, she actually said then that one of the first things that she would do, or the government would do, if Labour got in and formed a government, is they would means test winter fuel allowance. And within a few weeks of them getting into power, that's precisely what they did. So you've had that, and then they've done a raft of measures, including introducing a private members bill called End of Life for Terminally Ill Adults Bill, which has been presented by Kim Ledbetter and had its second reading in November, which many MPs voted for. It went to committee stage, and a lot of the amendments and clauses that were in the bill have been watered down or voted down, and now it's going to the report stage on the 16th of May. And this is a really worrying piece of legislation. So the committee have kept in this bill that if you're a financial burden, or you feel financial burden, you'll be able to apply for assisted dying. And if you have anorexia and the NHS thinks you're terminal, they'll be able to get you to apply for assisted dying. So there's two things here, but they're also looking at expanding what terminal definition means. So at the moment it's 6 months if you've got a 6-month terminal diagnosis, but they want to increase it to 12 months and include in that progressive conditions like motor neurone disease, multiple sclerosis, and neurological conditions like that, which is really worrying. And then, of course, what's caused the huge amounts of anger is the disability green paper called Pathways to Work that will see over £9 billion worth of cuts to disability benefits and support by 2029, 2030. And then, of course, we've seen with the county council elections in England last night, Labour have lost a lot of seats. And, you know, what's really concerning, and I think this is a conversation disabled people need to have, reform are not the answer to this. And to see 28% of disabled people thinking of voting reform is an absolute travesty, and it's a nightmare, because Reform want to abolish the Equalities Act, diversity, equality and inclusion in the workplace, abolish the Human Rights Act, and they want to bring in a health insurance model for the NHS. And they've got absolutely nothing to offer disabled people. And I can understand right now that a lot of disabled people feel politically homeless.
These are things that I listed I wanted to ask you about. And yeah, I think the real concern with reform is that a lot of people haven't been presented with or engaged with the policies themselves and actually looked at what reform would do about in government. And right now it's just at a state where they are still a protest vote. And so I think that's an alarming thing that people haven't kind of clicked on to what their policies are, as said, more of like an Americanized healthcare system that would, as I said, would be disastrous because like I would take a lot of people's income out and push more people towards poverty. And it's as you was touching upon like the issues around PAP, that's some of the things when I had listed. I mean, it's like the stuff that I know you've been campaigning on with DPAC since we last talked, as like legislation for the assisted hiring bill being debated, that you've been campaigning for assisted living. I would also want to ask you about what the process of whether like you think it's right that government are allowing it to go for the private members bill process. But I want to ask you a bit about the assisted living for argument and what it would mean for the government to address assisted living and what would you intend to do about assisted living and improving the care for disabled people.
What we're calling for, because the government need to concentrate on these things. Now is not the time to call for an assisted dying bill when they need to concentrate on fixing the NHS and readdressing the crisis that we have in social care and put in money into palliative care and pain management. And the issue that what we're saying is we need assistance to live. So that means we need financial support, we need accessible housing, we need accessible transport, we need an NHS based on Nye Bevan's principles, free at the point of need, paid for by progressive taxation, a publicly funded social care system free at the point of need, paid for by progressive taxation, where the staff are given decent pay and terms and conditions, and palliative care, hospice care, pain management is a postcode lottery, and the government need to do more to invest in pain management because pain management procedures and treatments have moved on leaps and bounds over the years, and palliative care and hospice care is a really vital resource. But also the crisis with carers needs to be addressed. To see carers support centres being closed across the country is an absolute travesty, and families up and down the country are giving millions of hours in unpaid care support and are not getting the support they need. When the government should address all the issues around that I've just talked about, and then when they could fix the NHS of social care, then we could talk about assisted dying. But what we're concerned about with assisted dying is that with the cuts, Labour have brought in yet more austerity, and we've had 15 years of austerity under a Tory government. Have you seen around the world, in Canada, in Oregon, in the US, in Belgium, in Holland, in New Mexico, and other states in the US, over time, the criteria for assisted dying is widened out. And what we're concerned about is disabled people will only be given one choice. And we're already seeing Wes Streeting with his NHS 10-year reform plan that he's going to give GPs £20 not to refer a patient for hospital treatment or to see a consultant to get the waiting list down. People need hospital treatment and people need to see consultants. And privatisation of the NHS is not the way to go about this. And the government thinks austerity is the way to go, and it's not. All it will do is just increase more poverty, more homelessness, and more disabled people. And many groups in society will die as a direct result of it, as we've seen with 15 years of Tory austerity. Assist us to live is hugely important because we want to live in society with our needs met and just living our lives as best as we can. Isn't that what most disabled people want?
Yeah.
We can be we are productive members of society. We have a lot of talents and gifts and everything, and we just want to live our lives as best as we can. And if we have the right support to assist us to live, we can do that. But what the government's doing is taking all that support away to marginalise us and exclude us and make life intolerable for us. And that's just totally unacceptable.
Yeah, it's like you were saying, it's about the quality of living for disabled people and making that the quality of living for disabled people equal to that of a non-disabled person. And it's something that you want to be in, so that if that you would want it to be that, you would feel that feel in a state where no disabled person or no person with an illness is coerced or persuaded against the will or negatively into it of, assisted dying when it might not be 100% entirely their choice. And it's getting that confidence and trust first amongst those who would feel very vulnerable to what the assisted dying rules would entail.
I think what we're seeing with the bill and what's been proposed, what the committee, and we've got to say that this bill is not law yet, okay? But what the committee that have gone through the bill line by line and have added clauses and amendments, what they have suggested to MPs are that if you have terminal anorexia, you would be able to apply for assisted dying. If you were homeless, a prisoner, if you felt a burden, if you had 51% mental capacity. And this would impact on disabled people with dementia, learning difficulties, autism, many groups in society. And the safeguards, when they were going to have at the beginning, they were going to have a high court judge sign off on cases. That's been taken away. Now they're going to have this secret panel made up of a social worker and a psychiatrist, and the person applying doesn't even have to be there. And the issue you have is that, like I've said, and I think stressed, is that disabled people will be coerced, especially if a disabled person's in a domestic violence situation, or people can be coerced, and many disabled people can be, and pressurized into making a decision like that. And for the committee to say if you've only got 51% capacity that you'll be able to apply for that, I think is incredibly scary and it's incredibly worrying. But we're asking MPs, because many of them had doubts about the bill when they voted for it, and Keir Starmer is from what we've heard, is very fanatical about this bill above everything. And the question has to be is, why is he so fanatical about this bill, and what the wider implications around this bill mean? And if people are really struggling to understand about the assisted dying bill and what this means, there's a really good documentary called Better Off Dead by Liz Carr that explains the reasonings why Liz Carr is opposed. And she went to Canada and had a look at the procedures and everything over there. And in Canada, where it's legal, medically assisted in death, many have applied who are in poverty, who are homeless, who haven't got financial support. And with benefit cuts coming in, that's a huge concern to many disabled people, that they feel they have got no other option but this. And Kim Ledbetter, if she gets this bill passed and into royal assent by 2029, she wants to bring this in. If it gets passed, that is when a lot of these benefit cuts will be impacted, and that will have serious implications on disabled people's lives. Now's not the time for a bill like this. And with a private member's bill, It's not covered by the Equalities Act. We weren't able to take a judicial review, and we couldn't get it through the legal system to try and put a stop to it. So we're fighting a huge lobby machine, which the pro opponents of assisted dying are. They've got millions for advertising. So I think it's important for disabled people to meet with their MPs and talk to them about their concerns about this bill and how MPs are considering voting for in England and Wales. How are they going to vote for this? But to meet with MPs and discuss concerns is really vital at this stage.
Before we move on to the next topic, seeing on that, I remember about in terms like the pandemic, then I remember hearing the varying stories about the volumes of disabled people with learning disabilities dying from COVID a lot higher than the rest of the population, and it was something, of course, the concerns around the do not resuscitate and things. And I guess if you were to look at the impact of this policy, you only got to look at the issues of people have around how like do not resuscitation orders can be implemented and used against disabled people. But moving on to a bit point about when you mentioned about the care services, and do you think that there is need for a national care service? Like I heard that been like a policy from some parties similar to that of the NHS of a more nationalised care approach.
Well, DPAC is calling for a national independent living support service because we've always fought for independent living, and the right for disabled people to live independently in the community is not enshrined in UK law. And when you look at our social care system, and I know it's different in Wales to England, for example, I think, but for 1 in 3 disabled people in England can't afford social care because the charges are so extortionate. So if we're going to have we need a publicly funded social care system, free at the point of need, paid for by progressive taxation, but it needs national independent living support service at its heart. And when disabled people are given the right support to live independently and their access needs met, and there is a chronic shortage of personal assistance in this country, especially when and stop the freedom of movement. So disabled people are struggling to recruit PAs, and carers are treated absolutely dismally with very poor working conditions and also poor pay. So there's a turnover of staff, and there needs to be a stop to this gross profiteering of residential care homes. That needs to be put a stop to. Yeah, we need a national independent living support service at the heart of social care that is publicly funded and free at the point of need, that everyone can access when they need to, and that their needs are met and able to live their lives as best as they can. And with this government, and this is what's such a horror show with them, they've had years to come up with a plan for social care and they haven't got one. And they've just kicked it down the path, carried on with social care charging and the gross profiteering of residential care homes. It's an absolute travesty. No one should be selling their homes to pay for care. No one. No one should have extortionate social care charges to be able to get the care they need, or many are going without because they can't afford it. That's totally and utterly wrong. Utterly wrong. And it's a stain not only on this government but previous governments who've allowed that to happen.
Based on like your own experience of being a carer, what are like the certain things you might have observed from your own experience that need to be improved? And maybe with that, do you think that family carers for someone within a family do need to be seen as like ours, that as a form of employment, and to get a similar wage to somebody who is employed as carer and get the same like employment protection.
Carers should have the same employment rights as every other worker. Yeah, and also be paid a decent living wage in order to survive. That is of vital importance, huge importance. But also, the DWP need to address this scandal of the overpayment of carers allowance and harassing the carers who've been impacted by that, and that needs to be, the government needs to put a stop to that. Carers are the backbone of
Yeah.
society, and they need financial support, they need emotional support. We need carers centres and safe spaces for carers, site centres, and our care system is in deep crisis. It's in deep crisis. The government are just not addressing it, and that is something that disabled people across the UK need to do some serious campaigning work around.
And moving on, what things have you maybe seen in the employment rights bill, and that, you know, as somebody who's a trade union member, what are the things that you've seen are maybe done to protect employment rights? Or do you think that within that bill, do you think that government have gone far enough in protecting employers' rights, employees' rights even?
To be honest with you, this government are not protecting employees, workers' rights at all. And also, I think it's important to say to reform voters as well that reform MPs voted down the employment rights bill. So that's another fact to tell people who are going to vote reform going forwards, or you're having those discussions with them now. They need to be told that they voted down to protect workers' rights, and workers' rights, decent terms and conditions and pay are a huge importance. To be honest with you, there's a lot about the bill I don't know, and I won't profess. But as a trade unionist, when you see, for example, and I'm going to use an example here, when you see with the Birmingham bin strike that's going on, and Birmingham Council want to cut drivers' pay by 8,000 a year, and the women refuse workers were paid less than the men for doing the same job, which is why the dispute started in the first place. And now they want to cut the drivers' pay by 8,000. And Unite have faced a lot of criticism by taking this strike action. They were right to take this strike action because with bills going up, rent going up, your mortgages and all your bills, you've got to put food on the table and pay your bills. And when you take a huge, massive pay cut like that, you can't afford to live. And they've been treated dismally by Birmingham Council for financial decisions that the workers didn't make. And this is going to be happening across the country. And the workers are really angry. You're going to see in the NHS over 100,000 NHS staff losing their jobs, the replacement with artificial intelligence. And I think the government should be doing more to protect workers' rights. And also for Rachel Reeves to dismiss teachers, doctors, and many other sector workers who are asking for a pay rise, and she's saying there isn't that money to give you a pay rise. That's absolute rubbish. The money is there, but also what the government are refusing to do is tax the wealthy. And that is why trade unionists and many groups are calling for a wealth tax and make the rich pay their fair share. Why should they get away with the wealth amongst the 1% is growing exponentially, and the 99% of us are paying with cuts to services, cuts to job, cuts to workers' rights. But the government needs to do more around the employment bill. But it is really important that fact with reform, they voted down the employment right bill because they don't want workers to have rights.
And what? Yeah. And what are the things that would you like to see anything like universal income implemented? And would you also like to see the government taking it seriously to an emergency budget where they look at new taxes and looking at addressing some of the faults with disability benefits and actually so
You
that they listening to people?
wouldn't cover all disabled people's needs. If we have higher costs than non-disabled people do, and it just wouldn't be enough when you've got social care needs, you've got your bills, you've got the additional costs of being disabled. It just wouldn't be enough, and it wouldn't work. What we need, we have the lowest benefit support in Europe, and it's an absolute dismal state of affairs. But no, I don't think for disabled people, it just wouldn't be enough for us to have a decent standard of living and to get the additional support we need. It wouldn't be enough.
And
They
on,
need to,
yeah.
the social security system, and make sure that we have a decent standard of living so that we're not in poverty.
And in terms like, with this, would you like the government to like do an emergency budget or really look at bringing the financial statement forward and actually what would you be like in specific taxes or what specific spending measures would you like to see in the up and coming budget?
A wealth tax. Stop the attacks on disabled people, stop the attacks on the working class, and tax the rich. That is what the government needs to do. It needs to change its entire track of austerity and attacking the working class, because if they don't, they're just going to allow reform in. And in 2029, we'll have a reform government, which will be an absolute disaster for disabled people. It will be a disaster for the UK. So to Rachel Reeves, here's a message: stop austerity, stop the attacks on disabled people, stop the attacks on workers' jobs, pay and conditions, stop the attacks on the working class, and bring in a wealth tax and tax the rich. That is what she needs to do.
I know what
Make
that. Yeah,
uh,
Carol. Yeah, I know at the last election you felt politically homeless, and I know on the day of the election you felt you weren't sure if you were going to vote or if you were going to vote at all. And do you feel like there's still like a sense of being politically homeless and feel like no party you would be voting for or represents you at the present?
there is no political party that represents disabled people at this moment in time. Okay, none. I've
And
never voted. I've never voted Conservative. I've never voted Reform. Lib Dems got into bed with the Tories with the 2010-2015 coalition, and Ed Davey last year actually defended the Lib Dems' time as a coalition government, and many Lib Dem MPs voted for assisted dying. And you've got the Greens who are calling for an increase in NATO spending, which means cuts to services elsewhere, cuts to disability benefits for us. And also they support assisted dying and voted for Kim Ledbetter's private members bill. Labour are an absolute, and they don't represent disabled people. And Reform are not the answer for this.
do you see
I,
any do you see any like smaller parties like outside? Like I know that there is, I've seen you either been reposted something or transform politics in a blue sky. There are. Do you think that there needs to be like another like party that represents like the interests, as I say, of disabled people? Do you see anything that could come up and
I think
anything that could be?
are fed up with party politics per se and the corruption in the political system, the gravy train they see MPs on in Parliament. And I think that's how independent candidates standing on single issues or a couple of issues. And what we saw last year in the general election was an interesting shift where we saw where Jeremy Corbyn stood as an independent and he won, but where we saw people standing on issues around such as Palestine or the NHS or something that matters in their community, and they're winning on those issues. And I think, to be honest with you, many disabled people are turning away from party politics because they don't feel represented by any political party. So they're looking at independent candidates, or they're just not engaging with the political system at all because they just do not feel represented. And when a political party, people can say what they like at election time and they can promise the earth. And every political party that gets into parliament or into power, completely corruption, politics corrupts, doesn't it? So I think disabled people, if there's an independent candidate in the local area, they need to look at what they're standing on. Will they support disabled people? What do they know about disabled people's issues and rights and stand? And also, I think more needs to be done to support disabled people into public office. So to stand as councillors and to stand as MPs and represent disabled people's voices in Parliament, which is very unrepresented.
What things would you like to see being done to allow for more disabled people to be involved with politics, be it at local government level or be in seats as MPs?
I think there needs to be more funding available for disabled people to stand as MPs, to be supported to enter public life and to become councillors. And disabled people have a lot to offer in politics, but the government are not having disabled people in politics. Marsha D. Cordova has often reported that Parliament is very inaccessible, that she has continuous battles to get accessible paperwork and access to documents so she can take part in debates. I do think that funding should be more available for disabled people to look at entering into politics, and also for councils and Parliament to do more to have accessible documentation and accessible spaces for disabled councillors and MPs to access. Parliament is one of the most accessible buildings, and often our council chambers are often an inaccessible space. And all of our spaces should be accessible, and that we have the choice to enter public life. The funding is there, and a disabled person supported to run as a candidate. And I'd love to see more disabled candidates running for office at local and national level and getting into Parliament and representing disabled people.
Have you ever thought about running for any public office, be it at local council level?
No, I wouldn't like it because I'm too outspoken, and I wouldn't keep my mouth shut. I'm a community grassroots activist, and I couldn't run for, well, I just could not listen to the drivel that you hear in the council chambers and you hear in Parliament. I'd end up throwing something at someone. No, that's not the space for me.
So, of course, you went to see a lot of change and you involved collective activism. How do you think that over the next couple of years to throughout this parliament, do you think we will be seeing collective activism work to bring around the change that you want to see?
I think what we've seen since the Green Paper has been published, what's been really great to see, we've seen organisations like Crips Against Cuts and Disability Rebellion and younger disabled people getting involved in activism for the very first time, which is an absolute joy to see, because we need younger disabled people in the movement. But I think what is so vital now, and I've always advocated, is that we need a unified resistance movement to fight for a better society, to protect our services, so they're not only there for us, but our children and our children's children. But to see in the last 4 or 5 months more disabled people, younger disabled people getting involved in activism in the first time, taking to the streets, using their voices. That's a really positive thing, and we should encourage that, build upon that, but also to say to disabled people who think campaigning is a waste of time, it isn't. That when you work together, you can enforce change and enforce positive change, and working with allies, you can actually bring about the campaign aims and objectives that you're looking for. For DPAC, we've fought the government, we've been resisting the government for 15 years. We've had some small wins along the way, but also I think it's important that disabled people are heard, that they're visible to be seen fighting back, and that the government doesn't think we're a pushover, because we're not.
And what do you say is best for people to get involved, especially with the new group Crips Against Cats, as I know has been going a lot, being existed a lot less, founded more recent than Disabled People Against Cats. And how can people get involved and kind of join in with the political activism?
There's loads of ways disabled people can get involved in activism. Not every disabled person can join street action, and that's understandable. But there's loads of ways you can get involved online, do what you're doing, a podcast, make a film, make a short video, be creative, poetry, music, song, dance, art. There's loads of ways to get involved in activism. Write to your MP, sign a petition, join a local group, or join a. And what's so important is that people shouldn't feel intimidated by joining a group or feeling they're not welcome, because they are, and that they have something important to say, and that new ideas are welcome, and we should encourage new people to join, because that's how movements grow, and we're not going to be around forever. So people, younger people, are the future of the movement, and we should welcome it, encourage it. But there's loads and loads of ways for people to get involved, and people have to feel to join in where they feel comfortable and where they feel it welcomed. And I think when disabled people are at home and they can't get out, live streaming of events is hugely important. Watching Parliament debates, writing to MPs, using social media, and there's loads of different social media platforms springing up all the time. Making a TikTok video, joining Blue Sky. There's loads of things people can do, but they have to feel comfortable doing it, and don't be put off by negativity. Just keep plugging at it and join a campaign, and we welcome new people along.
And a lot of people can feel a bit dispirited and downbeaten by a lot of what's going on, because a lot of disabled people, they are scared and petrified about a lot of the changes, the benefits, and as I said, about the assisted dying bill. But to keep people going with activism, you need that sense of hope. What helps you think that you can achieve positive change?
Do you know, when I joined DPAC, and this is years ago now, I a friend of mine to the cuts, to benefit cuts actually, and I was at my lowest ebb, and I come across this group on social media called DPAC, and I thought I was really angry and I needed to put my anger somewhere. And over the years, DPAC's kept me alive, because I've turned the anger into action, and it spurred me on to bring change to my community. We've got lifts at 2 of my local train stations now. We've saved some services. And I think the most important thing to people to cling on to in a dark time is hope. And hope is a good thing. And that hope, it never goes. And to see disabled people out there fighting for justice, fighting for inclusion, fighting for equality, that is a really constructive thing. And it's something to hold on to when you're despairing, knowing that there's disabled people fighting, and to turn the despair into hope, the anger into action, and then you're part of a social movement. So you're being a part of something, and you can effect change. It takes time, but you can do that, and not to lose sight of it.
And can you tell me about what's up and coming protests, movements, demonstrations that DPAC going on? Or I know like you was at a May Day conference yesterday. Can you tell me more about the events that people can either see and attend or take a part in that? Maybe you can signpost people to it.
There's local May Day rallies happening across the country at the moment, and there are disabled speakers at them. I spoke at the London May Day rally yesterday. There's going to be a national lobby of MPs on the 21st of May from 12 noon to 4 p.m. in Parliament. So write to your MP and say, I'd like a meeting with you. We're going to be at Parliament on this day. I want to talk to you about benefit cuts and things. Can you meet with me in person? So that's another one. The assisted dying bill is going to be at the report stage of Parliament on the 16th of May. So we're asking disabled people, if they live near London, to come and support the vigil outside and meet with us and talk to us about why we're there. I think that's really important. And I think when there's things happening in the news, tweet about it, write about it, do a podcast about it, do a film about it, do a song, a piece of music, poetry, a painting, because all of those levels of resistance are so hugely important. In June, we could probably have the third reading of the assisted dying bill before it goes to the House of Lords. So that's going to be massively important for disabled people to contact their MP and tell them why they're worried about the bill and get involved in talking about that. And then on the 28th of June, DPAC have a conference, migration and it's called Migration and Justice, and about disabled people and migration of disabled asylum seekers and everything. So that will be really important for people to support, and you can book a ticket and support that conference, and there will be stuff online to support. There's local demos happening around welfare, not warfare. I know there's things going on in Wales and Scotland and across England around your local demos. So look out for the hashtag welfare, not warfare. And if you see something, support it online or support it in person and get involved. And also reach out to campaign groups and say, how can I get involved? I'd like to get involved. I want to join. I've got all these skills and I want to do something. I'm creative. I'm an artist. I'm a photographer.
Can you tell me a bit about what things that you've been talking about at these rallies and conferences, and what have been the things you've been hearing from whether people attending events?
Obviously, a lot of the talk is around the disability benefit cuts, what the impact will be, and what support we need from disabled people and trade union allies. We're promoting a crowdfunder that DPAC have set up called Tax the Rich, Don't Rob Disabled People. So we've set up a crowdfunder. We're trying to raise £10,000 to fight disability benefit cuts. And I know it's hard to set up a crowdfunder, but we were left with little choice. And also about the concerns about the assisted dying bill, but also the impact of council cuts on disabled people's lives, cuts to transport. There's all manner of things that are being attacked at the moment. And many disabled people are involved in the Palestine movement, anti-austerity movement, climate change impacts on disabled people, and wars disable people, and wars displace people, and disabled people are hugely impacted by that. And there are many trade unionists who are involved supporting what is called the Shufak camp in Palestine, which is in occupied West Bank, and that is a camp for disabled Palestinians. So trade unionists have been raising money for disabled Palestinians who have been injured by the absolute horrendous war that's going on over there, the genocide that's happening. And it's important to hear from disabled Palestinians what's going on and the impact the conflict is having on their lives. And we're not hearing as much from disabled people's Palestinians' point of view on this conflict as we should do. But there are many different campaigns that disabled people want to be involved with: accessible housing, accessible transport, climate change, becoming trade unionists, anything.
Yeah, and this is something they hopefully get other guests on and talk about on coming episodes of this podcast. And since you're quite busy, I'm like, I don't want to keep you too long. I just want to ask if there's any conclusive final words, or is there anything else you want to mention and summarize, and what is the main message you want to tell people?
The main message is this: don't lose hope. Because of what the government are planning, that there's no hope to fight back, because there is hope, that we're looking at legal action, that we are building campaigns, we're working with allies, and we are campaigning day and night to fight back. But if disabled people can support DPAC's crowdfunder, that would be really helpful, because we do need that solidarity. But what I would say is, join a campaign today, and let's build the resistance and fight the government back. And also, actually, on the 7th of June, People's Assembly are having a national demo on the 7th of June. Stop the cuts, tax the rich. So they're putting on coaches across the country, or trade unions are raising money to pay for train tickets for disabled people to get to the demo in central London. And I think it's really vital we have a big presence out there, or disabled people are supporting online, sharing a video, making a video why they're supporting the demo, and join in.